So we're going to talk about the adrenal glands, and I know we've had lots of amazing lectures from the other veterinarians and such about all the awful things in the world right now. But you guys, we are equipped to deal with this. We're going to talk about ancient stuff. We're going to talk about the thing that evolved with us, and we all know adrenaline. It comes from our adrenal glands, and it's from the oldest parts of our body and brains, and we've got this. And then we're going to talk about how we deal with when it goes a little sideways, with some really ancient but reliable ways to deal with it.
Yeah, it's you can totally lean on your adrenals to, and you probably know the hormone adrenaline, right? That's where it comes from. So normally, under certain circumstances, you kind of store it and bank it, and then you call on it when you need it, such as to lift a car off whatever, your 6-year-old.
But they do have a dark side, don't they, Dr. Steve?
They do have a dark side. And one of the dark sides is Cushing's, which I'm sure most of you have heard of. But you might not understand anxiety as another dark side of the adrenal glands. You might understand it as a brain problem. We're here to kind of reframe that for you. But first, we should dive into Cushing's.
Yeah, and we're going to talk about those two things. So Cushing's and stress, and also that gets into the sex part. Let's go over what Cushing's disease looks like / metabolic disease, because Cushing's disease is just kind of the end product of metabolic disease, right? And what is that?
Right. So on the slide there is a typical Cushing's dog. So the typical signs of Cushing's, they're
thirsty, hungry, muscle wasting, pot-bellied.
Yeah.
A lot of people will be on to ask Dr. Steve, and they'll say, I just assume it's Cushing's, but it could just be metabolic syndrome. So the big difference is that the liver enzymes go way, way, way up. And where this is coming from is cortisol, like too many steroids in your body. So we're gonna do a little what your body's doing, what's normal, okay?
Okay. Under normal circumstances.
Normal circumstances.
Brain, adrenal.
Okay.
I say I'm seeing something potentially I might have to rally against. I think I might need a little help from my adrenals. Adrenals, would you care to spritz me with a little bit of your goodies?
Oh, squirt, squirt.
Thank you. I said spritz, but whatever. I feel like I can now rise to the challenge and see. Okay.
But then what happens in Cushing's disease?
Okay, so here's what happens in Cushing's disease.
Okay.
Supposedly, there's a pituitary tumor, pituitary-dependent hyperadrenocorticism. And the brain is just bothering the adrenals all the time. Here we go. Give me your steroids.
Okay.
Give me your steroids.
Okay.
Give me your steroids.
Okay.
Give me your steroids.
Squirt, 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 squirt.
And see.
See.
Okay. So now that we've laid out what most veterinarians are taught is the cause of Cushing's, I'm going to burst that bubble. We're going to burst that bubble. We're going to put it out there that the main cause of Cushing's is the food in most dogs that have Cushing's disease. Now, I never learned that, but once we realized that was the case, because we started treating animals that way, then Kären's and my habit is always to circle back when we get success with holistic medicine and say, how the heck did this happen? Where's the science to support what we can see is plainly in front of us? On the chart there are spikes in cortisol after you eat. And the more that the food counts as overnourishing for you as a species, the higher the spike.
Right? More your cortisol's up.
Yes. So what's overnourishing? Overnourishing we can define in biological terms as something that just has a very high glycemic index, is rapidly absorbed, rapidly assimilated into the system, almost to excess. That is facilitated by food processing. And if we make animals work for their meals and have to expend a lot of energy and break something much more complex down, then glucose goes up much more slowly, insulin levels stay down, we don't get the cortisol spikes. But otherwise, an animal that's getting 2 meals a day of kibble for years, the adrenal glands literally hypertrophy. This is the idea that it's a pituitary problem. That is actually a myth that has been debunked in the literature many times over, and yet veterinarians are never taught it because they don't know what the replacement theory is. But we're telling you what the replacement theory is.
Yep. And so raw food is great. I know a lot of people here are feeding raw, but also sometimes dogs won't eat it. If they have gotten to such a point of inflammation and they have these smoldering pancreatises, the beauty of raw food is that low glycemic index. So if white bread is 100, we're trying to get way lower than that, so we don't have all these spikes. But some animals, they just can't, they don't have the digestive power to do that. So every time you cook something, you're helping them with pre-digestion, right? So you can gently cook or you can cook. The point is to get them on something that's real food, but it's so don't be like, oh, we've got to do raw. Of course, that's ideal. But again, if a dog isn't quite there was a question, I forget whose lecture is about why is my dog better on ZD or Royal Canin or Hills. And in my opinion, though I'm not an advocate of kibble, it's just that animal must be so run down that is what they can digest right now. That's where they are. So the goal of the holistic vet is to build them up with health. Like I think it was Dr. Nick was talking about building them up so they can be on a real food diet. So Dr. Steve, what do we use herbally? Because we don't just use diet.
Well, first, I want to do a sidebar.
Oh, we are gonna. I'm watching.
No, it's a short sidebar.
Buddy. Okay.
Short sidebar. 2 sidebars actually.
All right.
Maybe 3. So you might be thinking, well, how did we come up with the idea that it must be food? Because remember, we didn't read the research first; we read it later. So how did we come up with the idea that this is a nutritional or a metabolic problem? And it was from the fact that Kären and I, when we're faced with difficult issues, I have had so many learning experience because from a veterinary or an owner that comes to the clinic and says, my dog's hip is displaced and I don't want to do surgery. And it's like, I don't think I can fix that. It's like, but I want you to try. It's like, I don't think I can fix that, but I want you to try. So, and lo and behold, when we try to do things that you insist upon, they often work. And so we learn a lot from you and your insistence. So kudos to all of you. The way that Kären and I confront those, I don't know how to do that, well, I insist you try, situations is we put on Chinese medical hats and we look at things from a Chinese medical perspective and we say, well, let's pretend that we never heard the word adrenal gland or a pituitary. Let's pretend it's 1,000 years ago and it's in China and this patient has those symptoms. What would they say is wrong? What they would have said is wrong is a condition known as damp heat. Damp heat is created in Chinese medicine from a patient that eats too much. Why don't we try 4 Marvels, a damp heat treatment, to treat these Cushing's animals? So she tried it and it worked. And then when we went to the research, no research. But guess what? You go now to PubMed because of Kären's bright idea, and you look up the ingredients in this formula, and it's been researched now for its impact on the adrenal glands. So don't believe that holistic medicine can't change the world. So we have a Shitson with Cushing's confirmed by ACTH stimulation test. And it's got the classic signs that you saw some of those in a previous photo, the thinning of hair over the trunk. Alkaline phosphatase is a liver enzyme that tends to go up dramatically relative to the other ones in a dog with Cushing's, usually 5 or 6 times what would be considered normal.
And also metabolic syndrome.
Also metabolic.
Which is just the precursor, right? So if you had a negative test for Cushing's and your animal still had all this, it just puts them into metabolic syndrome.
Right. For example, high blood fats and high cholesterol. Yeah. It's just a function of eating processed foods, right? They get the same insulin resistance and metabolic impact that we do.
Inflamed, eating CD, that's not good.
We want to talk about why, in this instance, ZD or ZD is exactly the wrong thing for this dog.
It's like ultra processed.
Right. So we had that graph, right?
It's like of all the kibbles, it's yeah.
And the worse things get. So it was exactly the wrong food for this dog. Small wonder they got Cushing's, right? And we gave the dog 4 Marvels. We changed to a commercially raw pet food. And we supplemented with cooked vegetables and antioxidants and fiber. Cut that ZD right out. And people often ask us, they often ask you, like, should we be using Veteril? What do you think about using Veteril on our dogs?
Well, generally we haven't had to use it. when you have this protocol, right? So that hasn't been a problem. You do have the 4 marvels.
Yes.
So if you have a holistic veterinarian, the naturopath granules are, organic and concentrated, and that's a really nice way to use it. If you don't have a holistic veterinarian, you can get the prescription strength Con product, and that is in tablets or liquids, just so you know. It's such a common problem because it's for dogs that eat kibble or dogs that get like Cushing's.
Yeah. One thing about Con Essentials, I find you have to double or maybe even triple the dose to get a meaningful impact, the impact that we're looking for as practitioners.
Yeah. Dr. Steve, when do you recheck blood work once you've started 4 marvels and a diet?
Well, I oftentimes will be looking for those first improvements and even just like a month out. But by 2 months, you should definitely be making headway. There should be no imagination to your dog getting better. Yeah. It should be showing on lab tests, showing on x-rays, showing on ultrasounds. There's no wishful thinking going on.
Within 2 weeks. So I think checking liver enzymes after 30 days is completely reasonable.
Yeah.
Yeah.
And of course, they diagnosed this pituitary-dependent tumor because of an ACTH stim test. That's the gold standard. Does your dog have Cushing's or not? So we repeat these tests, they never show positive again. So from that Western medical perspective, we have cured the dog's Cushing's. And it really wasn't that hard because we're here to tell you it's a dietary issue.
Yeah, and you can also use milk thistle with this. It's not on the slide. Milk thistle is just a great antioxidant, and it stabilizes the swollen, upset, pissed off liver cells. And it was my gateway herbal plant into alternative medicine. It's great.
Now, some animals will not respond to this approach, and we're going to talk about what I use instead as the plan B.
But we're going to get into talking about anxiety,
which you might not understand as an adrenal excess.
Yes.
But we're going to lay that out for you why you should be thinking that way.
Okay. So what we want to do is talk about what stress is, and we actually need to recap this visually. The definition of stress, which we don't think about because it's just part of our vocabulary of life, is failure to adapt to changing circumstances. You just can't adapt. You are just stressed out. And remember, the adrenal glands are just so old. They're from lions, tigers, and bears. They have brought us from when we were like running across the savannah. It's such an important part of our fight and flight. And yet, with the modern age, we think, oh, we can't feel any stress at all. We just want to be able to modulate it. We don't want our animals being crazy, and we don't want to feel crazy ourselves. But anyway, let's just recap what's going on in the body. Okay. So here is a normal body.
Okay, to recap.
Recap.
I say, I believe that there's a situation coming up that I must rally to face. I think I need some adrenal gland output. Please, adrenals, would you care to spritz me this time, with your adrenal hormones? Go.
Spritz. Squirt.
Wonderful. Thank you.
Okay.
Thank you very much.
Now.
And see.
No. Okay. It's not quite the seat.
Not quite the same.
Okay.
Part 2.
Part 2. This is stress, okay? This is what's going on in her brain. This is the dog that's driving to the veterinary hospital and doesn't like the veterinary hospital.
Oh, no. I'm a little alarmed at this situation that is developing.
Why? What's going on? Squirt, squirt, squirt.
No, that's not. Now you're making me more anxious. But now I'm more anxious. I somehow need more adrenaline.
Squirt. I think I need to bark. Ha! Wait, bite. Rain, you need to bite. Bite!
Okay, sorry. I'm off the clock. Okay, biting. I'm worried.
Squirting! Squirting!
And scene. So stress, by being a failure to adapt, means that there's a continual draw on the adrenal glands. And the adrenal glands keep pumping out these hormones, and they keep driving the stress response. We're going to show you a diagram of that in a second. But, Kären, how do we facilitate adaptation to stress?
Well, we use things called adaptogens. So these are plants that actually stabilize your adrenal glands. And this is where it just gets so fascinating because integrative medicine and holistic medicine and herbal medicine is so powerful because we do not have drugs for our adrenal glands. We have this huge problem. Everyone knows this thing, fight or flight. But every drug that we have is at our brains. It's all serotonin. Like, how do we calm our brains down? It's with your brain, brain. And I'm going to talk about the brain a bit. We are CBD. But this is a huge part of our animals, you know? We've all heard about ginseng, and ginseng is a great plant. It's doctrine of signatures. So you guys know what that is, where the plant actually looks like the thing it does? Ginseng looks like a little man, like little life form.
Yeah, the Chinese name for it is called human root.
Human root.
Yeah.
It's wild.
Looks like a person.
And it is like this vitality thing. So it's very, very cool.
To us, this idea of like, let's deal with stress not with antipsychotic drugs, let's deal with stress by focusing on the adrenal glands, that's kind of a novel concept maybe for us, because we don't even have a drug that does it. But we do have herbs, and it's telling that one of the oldest herbal formulas in history, this is literally 2,000 years old, is this Bupleurum dragon bone and oyster shell combination. It's fossilized bone from dinosaurs, mammoths, etc. But it's calcium, lots and lots of calcium. So early Chinese cottoned on the idea that calcium can be a soporific. So when somebody has a little warm milk before bed, you're taking that calcium and you're helping yourself sleep. That's part of how it works. And then part of how it works is on the adrenal glands that Kären was talking about, having this adaptogenic effect. The big player in there, as Kären mentioned, is ginseng. We have a couple of other calming herbs. So skullcap the herb, is a calming agent, and rhubarb root is from a Chinese medicine perspective, it's meant to take all this yang that's in your head and, as they say, return the yang, which means return it to the body core. So those are some of the big players in that formula. And when they studied this to see, does it actually work? It does. It has a very clear effects in studies on stress-related hypertension in human beings. I have used that formula that was on the slide there in many people with hypertension, where a lot of the main concern is just the level of stress that they're under, and it works very well. Okay.
And so that is a big part of Halscion. So that was a huge formula. And the test market for that formula was just, homeless animals on kibble. Like, let's not kid ourselves. These are animals in all kinds of random old shelters and rescues, but people are not feeding real food diets. So it still was able to improve their quality of life tremendously by being calming, increase blood flow to their brain.
On the picture there of the brain, in the pink center of the brain, that's the area of the hippocampus and the amygdala. This is actually where stress as an emotion forms in your brain, in mine, and dog brains, deep inside the brain. Cortex is meant to somehow override those emotions. If you don't have good enough blood flow to your cerebral cortex, especially the prefrontal cortex, then you have a hard time talking yourself out of a situation, talking yourself down. So half of the formula is about the adrenal glands, and half of it is about making sure there's really decent blood flow to the prefrontal cortex to help animals reason. As we take the fear away, then they can look at their situation anew and talk themselves down.
I do believe in a multimodal approach, because usually, though I love herbal formulas because they have multiple plants working synergistically to get something, with behavior, especially extreme behavior, you often have to add in a little something else. I don't feel like, I don't want to offend anybody here who uses CBD. I personally, as a veterinarian, maybe my cases are severe, don't find it works as well as a solo agent, but as a playground playmate with somebody else, it really is amazing. So this is my take from what my experience is with medicine, and I'm going to exempt cancer, because cancer is a different kind of CBD usually. So you have three kinds of CBD. You have full spectrum, that has everything in it. That includes THC. Dogs have many more receptors, like 100 times more receptors for THC than we do, and they have it in a different part of their brain. So it is most of my colleagues who deal with cancer, bone cancer, do use full spectrums. But in general, when I'm dealing with anxiety, I don't, because that's the part that's psychotropic, and I haven't seen I haven't seen anything good come out of it. If you use a CBD isolate, then you just have CBD and you don't have the other parts of the plant. But when you use broad spectrum CBD, just think of it like yourselves, I'm a broad, then you have CBD and CBG and terpenes and all these things, and they're all working together. And they are working a lot at like an SSRI, like helping with serotonin in your brain. So it's a real synergy if you use something like Halscion and a whole food diet that's bringing more blood flow to the brain. And it's a more complete approach. And so that is why I would advocate for a broad spectrum. My thing about CBD, I don't use it alone, but I have used it quite a bit. And in Canada, it was okay to use far before the United States. And so we had a few years of experience with the CBD on that. And it can be incredible for pain in old dogs. Incredible. So have a case. So this is Mia. And she is, I don't know if you guys can see on the slide, but there's a picture of our software. This is the most common software used in North America for veterinarians. And it always has demeanor at the bottom. I don't know if you can see, it says bites, muzzle necessary. Yeah, so that's a thing, right? They already have you tagged. This is my patient here. So they came in because they wanted, they heard there was a holistic vet and they wanted a rabies titer. I'm a huge advocate of titers. It's a bummer because you can see that Mia's 10 pounds, psychotic, anxious, her adrenaline's going out of the roof. She's trying to kill us. And it's 3 mils of blood out of the jugular, you know? I mean, and you're like, how is this gonna happen?
I'll tell you something, some blood's coming out of somebody's jugular.
Somebody's blood. And on top of that, you know, the staff, they had always worked with conventional vets, so they're like getting the muzzle out. And I'm like, we're not using a muzzle, that's mean. And they're like, okay.
But so you had to tackle this situation, but you didn't just tackle it the night before, right? You had to kind of be a little proactive here.
Oh, they had to be proactive, yeah. So I put her on Halcyon. These are one of our first kind of cases after they come out of trials. And part of that formula is a liver formula called Yiguangen that's it's not quite as old though. I think it's in the 1700s.
It's probably older than that, but it's the half that looks after the blood flow to the brain. Yeah. And the other thing it does is it soothes the stomach. So with all these dogs that vomit first thing in the morning or they just have no appetite first thing in the morning, this Halcyon product oftentimes gets rid of that, partly because of this content of this Yiguangen.
Yeah, I switched her from full spectrum over to broad. We did that for a couple weeks. And I did also tell them to feed her a meal. And it's just a side note as a surgeon, because in the last few years, at least 5, our anesthetics have changed so much and they're so lovely. You can feed little dogs now before you go to the vet. I mean, you don't want them to be hypoglycemic and stressed out and this whole adrenal thing going on. They can have small meat-based meals like a little meatball. You really should talk to your veterinarian about it. If they're not up on their anesthetic, they're not using those safest anesthetics. Like, these little dogs need a stable blood glucose. So I don't want anyone hangry, and I don't want this dog hangry. She's just gonna eat me, you know?
Yes.
So she, we were able to, after just, I think it was probably like 17, 18 days of this, she came in. She was an excellent kind of case because this poor dog obviously had been, you know, people saw her coming, already had her labeled.
So Lena was client number 2 of this Lionel's rescue. And in the hour or two, I was just treating the dogs in the front yard of the person who ran this rescue. This dog was patient number 1. And his name is Brian James, a higher up in the San Diego Humane Society, who was, you know, very tight with Lionel's legacy. And she, when I offered my services just on a volunteer basis, Laura, who runs it, said, I know the perfect dogs to start with. And Lena's dog, Bismarck, was one, and Brian James was the other. What was Brian James' problem? He had the most severe case of cognitive dysfunction that I've ever seen, and hope to ever see. He would pace, I'm not kidding when I say 24 hours a day. To help stop him pacing, they finally gave him acepromazine. Remember the last talk? They're talking about offering Brendan acepromazine, so he would just, was it you? Or I can't remember. Anyway, they had this dog on acepromazine, which normally should knock a dog on its ass, but all it did was knock him out for an hour. And then the rest of the time, he would just pace around the house, and he would knock stuff over, and he'd bump into furniture, and he just couldn't stop. And it wasn't a feeble pacing, like you just pick him up and hold him, and he would stop. She described him as having this superhuman strength. Like there was just no restraining this dog. This was my first case, and he was just relentless. And so nothing like, being thrown into the fire, baptism by fire. So in Chinese medicine, we feel the pulse. That's what I always do anyway to start a case. Is like, where's the pulse? Because the pulse tells us a lot. You think, how can a pulse tell you a lot? Chinese medicine looks at the body as a mix of yin and yang. So yin is substance and coolness and moisture. Yang is energy and heat. Yin is sinking. Yang is rising. Yang is power.
And you guys know that Tai Chi symbol? That's a symbol of life. And so the goal in Chinese medicine, it's a metaphor, is keep that together. So when your yang rises and your yin, that separation is death. Nobody talks about that part, but that's death. The point is to keep it together. So he's got this pulse out here, which is not healthy.
His pulse, you feel with just the lightest pressure,
Yep.
and it's really just under the skin, and it's very stretched and dilated, which told me that his yang, the pulse depth tells you how mobilized yang is, and the fact that it was so stretched and ballooned out told me there was no yin kind of anchoring and holding and integrating it in. So I knew immediately that that was the cause of his relentless pacing. I needed to internalize his yang energy. It was the cause of his superhuman strength. This yang. So
what did you do, Dr. Steve?
well, I gave him acupuncture right on the spot, and I could feel his pulse sink into his body, so I knew it was going to work, or should work, and we put him on what became Halscion. So here's the outcome. For the first time in 5 years, he slept through the night. The owner was flabbergasted. I was flabbergasted. And he just continued to improve. Within a week, she was already taking him off all the drugs like Xanax and stuff that she had had him on previously. And so he just continued. Within about 3 to 4 weeks, he was off all his medications. He was sleeping through the night. He was a normal dog. Like, it was shocking. Okay. And we do find that the dogs that are the most severely affected behaviorally are sometimes the ones that respond the most rapidly to that Halcyon stuff.
And so our goal is always to get them better so we can get to the next disease, which of course is coming down the road. And that was back to Dr. Peters' first, you're not going to have all green lights, you're going to have some red lights. I loved that metaphor. And I think it's time to go back to what is happening when you are a year out.
So you might have imagined that that was just a happy ending, but there's a second chapter to Brian James, and apparently we need to suit up in order to tell you about it.
Yeah.
Okay.
Yeah.
So imagine that you're a brain and you've been on fire
You're Brian James's brain.
I'm Brian James, and I've been on fire for 5 years, and someone finally gets me to relax. And now I'm like, oh, I'm so tired. I think I need a little bit of adrenal stimulation. Can you just spritz me a little bit, please?
Spritz.
That's not enough. Come on, come on, come on. Give me it. Come on. Come on.
Spritz.
This is not enough.
I'm too tired. Go away.
I'm tired too.
Shush.
I'm tired too. Shh. Oh, no, I'm peeing.
You're so
Let's see.
disgusting.
You might be used to thinking of your Cushingoid dog. And by the way, what do we use when dogs don't respond to the 4 marvels? We use Halcyon. And that's because it works the same way, calming the adrenal glands down. So imagine that your adrenals have been just like giving, and they finally get a break. You oftentimes can expose an adrenal insufficiency. So a dog with adrenal excess is not always a dog with adrenal excess. They start to become adrenally insufficient over time. And you can sometimes see the same thing happening. A dog that is testing as Cushingoid, and then you look at certain laboratory changes, and you find that there's this adrenal insufficiency creeping up. What's one of the things we look for that is often missed in a lab?
Well, all your veterinarians, on all the labs, they're looking at electrolytes. So sodium and potassium ratios were kind of the traditional way to look for adrenal exhaustion. And so the cutoff really is 29 as a ratio. But what happens with a lot of veterinarians, especially now that we have our bloods in hospital, is that they forget to do the math. So they'll spit out the sodium, spit out the potassium, but they don't get their calculator out and do the ratio. So it's got to really, truly, we want it over 30. But if you have a dog that has signs of adrenal fatigue and incontinence or uncontrolled, kind of run down, you really need to look at that sodium-potassium ratio, and especially if it's 27 or under. So it doesn't mean, they'll be like, oh, well, it's not Addison's, that's the opposite, but it's adrenal fatigue. So if it's lower than that, like for example, our own dog was at 23, that was, the cortisol levels were gone in that animal. So that's an important thing to look for, just sodium, potassium. Your vet will know that though.
But they oftentimes don't check. So if they don't report it, then you should get your calculator out and just...
Yeah. Ask them, ask them to look for that. So Steve had on this slide, this formula is a great formula for adrenal fatigue. And I will tell you, every single one of my hospital staff was on this during COVID. It was 4 years of hell. It was just us. We had a great time, but we got headaches and we were tired. I'm pretty sure that little hospital had mold. And we took this instead of Advil. It was wonderful. Really just a lot of ginseng in it. And I think initially it was traditionally a postpartum formula for women who were really, really, really deficient after childbirth. Didn't know that at the time, but would have been good. And anyway, that's what used, and we used it a lot for incontinence in dogs that have adrenal fatigue and a rundown.
And that's how Brian James was manifesting a year later. He was manifesting with urinary incontinence, and he was much more tired looking. And he was just in a stage where he just needed his adrenal glands to be propped up further. He wasn't taking the Halcyon anymore because he didn't need it. So now we needed to buck him up. Now, some of you on Ask Dr. Steve, you may have encountered posts where they say, well, I tried the Halcyon and it didn't work. Or it actually cryptically, on a rare basis, it seemed like it almost made them more anxious. When we add in that last formula that was just on the screen.
Sorry, I'll go back.
It's
getting excited.
Con sells it as Lift the Chi. When we add that in, then you get a very balanced effect on their mentation and on their adrenal glands. So you fortify the adrenal glands even further, and you get this nice blended effect on their brain, and the anxiety goes away.
And Gold Standard Herbs is going to add it on. It's just we see it so commonly used, and we recommend it so much from Con. And I think the Gold Standard is nice because
it's called
Galvanize.
Okay, let's talk about sex.
Really excited about this slide. Yeah. Mostly because all my colleagues were talking a lot about hormones, and we've been talking about the spay thing, and it's really near and dear to my heart. So the ovaries are not the only organ in a mammal that makes estrogen. Your adrenal glands make estrogen. So if you spay a dog, and you should expect that when she gets stressed out and when she gets older, she's going to need to rely much more heavily on her adrenal glands. So I think we often forget that adrenal glands are making estrogen. And if they are depleted, they can't. So that's a really dangerous situation. And that's one more reason why it's really important to support the adrenal glands if you have done a traditional spay. Now, I have a very interesting road into my veterinary career because I was working in Thailand. And at that point, I just was in Thailand and spaying and neutering, and they've changed things a bit. But when I was there originally, in the Buddhist country in the 90s, it was against their religion to remove the ovaries. They were sacrosanct, or whatever that word is.
Sacrosanct.
Sacrosanct. And so my first surgical experiences, hundreds and hundreds of them, were just hysterectomies, ovary-sparing space. That's how I learned it first. I have been doing those for 28 years. It's an interesting change, and I would love to talk to people about who is a good candidate and who isn't, but this slide is really making you realize that if you have spayed your dog, and for example, we had a puppy we rescued, and we had her for 12 years, and she's lovely, and I wanted to do that surgery. I wanted her to have her ovaries, and she started biting all my surgery patients. I was like doing this, surgery, and I'd have to be stitching the dog's face up too, because my own dog had attacked. She was truly a bitch, which is the medical term. And so I had to spay her. She's not reliable around our young children, and that was that. So it is a really kind of hot topic, and I do believe that we should be super aware of the adrenal glands because of that. So if you do have a dog who tremors and shakes and is spayed, really that lift the chi.
Yeah.
And to talk to your veterinarian, hopefully you do have a holistic veterinarian, or you can ask about the different options for spaying. And then someone else asked me about neutering, and I personally just think if they're good boys, then maybe we just leave them, but sometimes dogs are aggressive and bite and growl and pee on things, and they're going to do that if they have a vasectomy, right? So you have to be very thoughtful. I have to be very thoughtful about who I talk to. I feel like, the conventional veterinary community has just published lots of papers in our most conservative journals advocating to wait on neutering Labrador retrievers until they're over a year old because of cruise ship tears. That seems like a small stone to step on, but yay, that's huge. That the conventional veterinary community is actually publishing research saying to wait on neutering because of hormones and growth. I think it's huge. So
Yeah.
I think it's a very positive step. So that's a big conversation, and I think
And
that
it's important to note too that they never publish a paper saying, oh, we should be spaying and neutering earlier. Like if anything gets published in that space, it's always like, should we be spaying and neutering all the time? So there's just doubt being continually raised about the practice. So, but as Kären is saying, there's a behavior element to it. And so sometimes some of the dogs are not manageable if they're intact.
so. What's the moral of the story, Dr. Steve?
If you are having to do a complete spay or neuter, anticipate that you might have to support the adrenal glands at some point. Be watching for those kind of cardinal symptoms, which are, they're not often in your face. We talked about how to find out on the lab work. Kären's also fond of doing a cortisol spot check just to kind of see where they are, not a full ACTH stim test, but just check the cortisol, see if is it in range. But there are some symptoms. Urinary incontinence is a major symptom of adrenal fatigue. Animals with adrenal fatigue, they're easily overwhelmed, same with people. So just as we're wrapping up, Bujong Ichitong, the lift the chi, soon to be called Galvanex, is probably our favorite major player in terms of dealing with this adrenal fatigue and its associated incontinence. But the naturopath and con formulas there, they all have this strong adaptogenic effect. They all work to support the adrenal glands to stop this urinary leakage.
These are just some other examples. So one of my favorite things is also using Medicago. So that's a specific kind of alfalfa that's high in phytoestrogens. And so I started supplementing that in instead of using whatever people would come in with, what is the name of that drug? The phenylpropylamine, propylene, and all these things for incontinence. You can substitute in phytoestrogens as well for the estrogen, as well as using these formulas that help the adrenal glands. So between substituting those, that's an excellent way to deal with that hormonal responsive urinary incontinence.
And actually some of those formulas also contain phytoestrogens. And soy isoflavones, they're oftentimes easy to find in a health food store. They're generally, if your dog doesn't have an issue with soy, they're generally very safe just to kind of ladle into the food, and that will sometimes cut down a lot of incontinence. And then finally, don't forget calcium. Calcium is needed for smooth muscles, which are the muscles of the sphincters, to contract firmly. So making sure there's enough calcium in a diet, which can sometimes drift a little low on real food-fed dogs, you might want to just supplement with additional calcium. And it's an anxiolytic, as we talked about.